Inhalation therapy, primarily through the use of inhalers, offers significant advantages in treating respiratory conditions like asthma, COPD, and sometimes bronchiolitis in older children. Unlike oral medications that must be absorbed through the digestive system and distributed throughout the body, inhalers deliver medication directly to the lungs, where it's needed most. This targeted approach provides several key benefits. Firstly, inhalation therapy offers rapid action. Because the medication goes straight to the airways, it starts working quickly, providing almost immediate relief from symptoms like wheezing, coughing, and shortness of breath. This rapid action is particularly critical during acute episodes, such as an asthma attack, where quick relief is essential. Secondly, inhalation therapy minimizes side effects. By delivering medication directly to the lungs, the dose needed to achieve the desired effect is often lower compared to oral medications. This lower dose, coupled with the targeted delivery, helps reduce the risk of systemic side effects, meaning side effects that affect the whole body, which can occur with oral medications. In primary care, inhalation therapy offers a safe and effective way to manage respiratory conditions. By delivering medication directly to the lungs, it provides rapid relief from symptoms, minimizes side effects, and improves the quality of life for individuals living with these chronic respiratory conditions. Here are some indicators related to asthma and chronic obstructive pulmonary disease in the Quality and Outcomes Framework of the General Medical Services (GMS) contract. Primary care contractors are to maintain a register of anyone diagnosed with COPD with spirometry. A spirometry test is a breathing test that measures how well your lungs work by measuring how much and how quickly you can inhale and exhale air. It's the most common type of pulmonary function test. Other quality indicators are related to the percentage of patients with COPD who have had a review undertaken by a healthcare professional, including number of exacerbations and an assessment of breathlessness using the Medical Research Council dyspnea scale. The percentage of patients with COPD and Medical Research Council dyspnea grade greater than or equal to 3 at any time in the preceding 12 months, with a record of referral to a pulmonary rehabilitation program. The register also captures patients with COPD and other comorbidities who have a smoking history and whether they have been offered support for smoking cessation. Similarly, for asthma, your primary care surgery will maintain a register of all patients diagnosed with asthma, those from age 8 and over with measures of variability or reversibility, the percentage of patients with asthma on the register who have had an asthma review, those aged 14 to 20 with a smoking history, and those with comorbidities who are recorded as current smokers and have a record of an offer of support and treatment for smoking cessation. Why do primary care clinicians prescribe inhalers? Breathing is something we often take for granted. It's an automatic process, essential for life. But for millions around the world, breathing isn't always easy. Conditions like asthma and COPD can make each breath a struggle. Inhalers are a vital remedy for managing these conditions. They deliver medication directly to the lungs, offering quick relief and improving quality of life. Asthma is a common condition affecting millions worldwide. The UK has one of the highest rates of asthma in the world. Around 6.5% of adults in England have asthma, which is over 4.3 million people. In children, asthma is the most common long-term medical condition, with around 1 in 11 children and young people living with it. When someone has asthma, their airways become inflamed and narrowed, making it difficult to breathe. The 4 cardinal asthma symptoms include wheezing, coughing, shortness of breath, and chest tightness. These symptoms can range from mild to severe, even life-threatening in some cases. It also can exhibit a diurnal pattern. Doctors usually look for this variability when reviewing peak flow meter recordings. Asthma is triggered by various factors, including allergens like pollen and dust mites, irritants like smoke and strong odors, respiratory infections, and even exercise. When a trigger sets off an asthma attack, the muscles around the airways tighten and the lining of the airways swells, further restricting airflow. This can create a frightening experience for the individual, making it feel like they can't get enough air. Understanding the triggers and symptoms of asthma is crucial for effective management. Inhalers play a vital role in this management by delivering medication directly to the airways, where it's needed most. By relaxing the airway muscles and reducing inflammation, inhalers provide rapid relief from asthma symptoms, allowing individuals to breathe easier and live fuller lives. In the UK, approximately 1.17 million people in England are affected by COPD. It is the second most common cause of emergency admissions to hospital and accounts for around 1.4 million GP consultations per year. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease that makes breathing increasingly difficult over time. The condition primarily affects the airways and tiny air sacs in the lungs, known as alveoli, which are responsible for exchanging oxygen and carbon dioxide. As COPD progresses, the airways become inflamed, and the alveoli lose their elasticity, making it harder to exhale air from the lungs. The primary cause of COPD is long-term exposure to lung irritants, with smoking being the most significant risk factor. Other risk factors include exposure to secondhand smoke, air pollution, and certain occupational dusts and chemicals. COPD typically develops slowly over many years, and early symptoms may be mild, often dismissed as a smoker's cough. As the disease progresses, breathing becomes increasingly difficult, leading to shortness of breath, wheezing, coughing, and chest tightness, especially during physical activity. COPD is a serious condition that can significantly impact an individual's quality of life, making everyday tasks challenging and limiting participation in enjoyable activities. While there is no cure for COPD, early diagnosis and treatment, including the use of inhalers, can slow the progression of the disease by reducing the frequency of exacerbations and help manage symptoms, allowing individuals to maintain a better quality of life for longer. Proper inhaler technique is essential for achieving effective treatment with inhalers. While inhalers are highly effective in managing respiratory conditions, their effectiveness hinges on using them correctly. Proper inhaler technique ensures that the medication reaches the lungs where it's needed, maximizing its therapeutic benefits. Incorrect technique, on the other hand, can significantly reduce the amount of medication delivered to the lungs, rendering the treatment less effective. There are various types of inhalers, each with its own specific technique. Metered dose inhalers, or MDIs, and dry powder inhalers, or DPIs, are two common types. MDIs require coordination between pressing the canister and inhaling the medication, while DPIs need a forceful inhalation to disperse the medication powder. Regardless of the type of inhaler, some general principles apply to ensure proper technique: keeping the inhaler clean, shaking the inhaler before use for MDIs and some DPIs, exhaling completely before inhaling the medication, inhaling slowly and deeply, holding the breath for a few seconds after inhaling, and rinsing the mouth after use for certain medications. Mastering inhaler technique is crucial for successful respiratory management. Patients should receive clear instructions from their healthcare providers on how to use their specific inhaler correctly. You can check the Asthma and Lung UK website for how to improve your inhaler technique. The link is in the description below. Regular checkups should include a review of inhaler technique to address any issues and ensure optimal medication delivery. What is the cornerstone for asthma and COPD management? Effective asthma and COPD management goes beyond simply using inhalers. Each individual should have a personalized plan tailored to the specific triggers, severity of symptoms, and lifestyle. This plan typically involves a combination of medication regimens and lifestyle changes designed to control symptoms, prevent exacerbations, which are times when symptoms suddenly worsen, and promote long-term respiratory health. Medications for asthma usually fall into two categories: relievers and preventers. Relievers, like short-acting beta agonists, or SABAs, provide quick relief from sudden symptoms by relaxing the airway muscles. Preventers, such as inhaled corticosteroids or ICS, are taken daily to reduce airway inflammation and prevent symptoms from occurring in the first place. COPD treatment recommendations are largely based on the Global Initiative for Chronic Obstructive Lung Disease, GOLD. Initial pharmacological management of COPD should be carried out according to the individualized assessment of symptoms and exacerbation risk, and subsequent categorization to one of four groups: A, B, C, or D. The MRC scale measures breathlessness, with lower scores, 1, 2, indicating milder symptoms, while higher scores, MRC 3 or above, indicate more severe breathlessness. Patients with fewer exacerbations, 0 to 1 exacerbations that don't require hospital admission, fall into either Group A or Group B, depending on their symptom severity. Group A patients have milder symptoms, while Group B experiences more severe breathlessness. In contrast, if a patient has more frequent exacerbations, 2 or more, or at least 1 hospitalization. They are categorized into Group C or Group D. Group C includes patients with milder symptoms but frequent exacerbations, whereas Group D represents patients with both severe symptoms and frequent exacerbations requiring hospital care. Following implementation of initial therapy, patients should be reassessed for attainment of treatment goals and identification of any barriers for successful treatment. Consideration should be given to inhaler technique and adherence and non-inhaled approaches. Follow-up recommendations are intended to facilitate management of patients taking maintenance treatments either early after initial treatment or after years of follow-up. After review, adjustments to treatment may be necessary. Most pharmacies in the UK will accept any empty or unused inhalers for proper disposal. The specific medications prescribed, their dosage and frequency, will depend on the individual's needs and response to treatment. Lifestyle modifications and managing other comorbidities play an equally crucial role in asthma and COPD management. Identifying and avoiding triggers is paramount. This might involve reducing exposure to allergens like dust mites and pet dander, avoiding smoke and strong odors, managing seasonal allergies with appropriate medications, and smoking cessation. Regular exercise, despite being a potential trigger for some, is generally beneficial for asthma control when managed properly. Maintaining a healthy weight, getting enough sleep, and managing stress are also essential for overall well-being and can contribute to better control. A well-structured management plan empowers individuals to take control of their condition, reduce the impact of symptoms, and lead active, fulfilling lives. It's important to develop self-management and preventive strategies while maintaining regular communication with your primary care clinician. This helps monitor your progress, adjust treatment plans as necessary, and ensure effective long-term management of your health.